When I met my wife, I was madly, absolutely in love with her, but I was a nobody. I had nothing. I didn't have a career. I didn't have a job. I didn't have anything. My name is Alan Valenzuela. I'm a physician assistant. I work in Pixley, California in family medicine, primary care. When I was a student, we were insanely broke. Just trying to handle the studies of medicine and sitting for the tests and getting everything organized, and then to worry on top of that with the tuition. That was very, very hard for us. I was fortunate enough, my program director informed me about Health Education Foundation. I mean, sincerely, if it was not for that scholarship that Health Education Foundation gave me, there was no way I would have graduated. Providing us with the funds to help us finish the school, it gives us that boost to and encourage us to work in the underserved communities and to help those in need. The thing about rural medicine is that a lot of people don't know how rewarding it really is. You get to be involved with the people, you get to be involved with their families, with their relatives. Primary care is very unique because it doesn't just deal with their diseases, it deals with the entire encompassment of these people. On the average, you see about 100 to 120 patients a day. We have a large influx of migrant workers. With Obamacare and this whole opening of a healthcare system, they all get insurances and they all need a doctor. What we tend to find is that we have these small little clinics that are just absolutely bombarded with patients. You go to any rural clinic in the Central Valley, there's not enough doctors here. The people that are running the majority of healthcare in these underserved areas are people like me, our nurse practitioners, our physician assistants. First thing that comes to your mind is, oh my gosh, that's a tremendous amount of studying, that's a tremendous amount of years, that's a lot of work, that's a lot of debt. The beauty about a physician assistant is that our schooling is only 3 years versus a medical doctor that you do it for, 10 to 12 plus years. They train us so well in treating pathology, treating diseases. We have our own medical license. I'm able to prescribe medicines. I'm able to essentially function just like a doctor. There's a lot of patients, they come in with absolutely uncontrolled diabetes. And within a series of 3 to 6 months, their diabetes is controlled. They went from a very high acute risk factor to almost no risk factor, only because I took the time to explain to them in their native language what diabetes really means, why these medicines are important. A family says, oh my God, you're the first that could actually know what I'm saying. So they bring their aunts, their moms, their grandmas. This clinic is growing. I think the most influential thing that got me to go into primary care was seeing this Hispanic gentleman in the trauma room. He came in coded, he had a heart attack. I called the code, a gentleman was brought in, I was doing chest compressions. And for some odd reason, maybe I was just tired, but the whole time I'm doing chest compressions, I'm looking at this gentleman. He reminded me of my dad. And I will never forget this guy's face because it kind of shocked me, made me realize, man, the answer is not in the emergency room, the answer is preventative medicine. What I'm doing right now, preventing heart attacks, preventing strokes, is essentially what I feel is crucial, because if you could prevent it, people live better lives. Getting this loan repayment, it essentially pays off my interest and a large part of my actual debt itself. It allowed me to take a day off a week, and I get to spend more time with my children. That's just huge, huge. It was a loan repayment that got me to work in this underserved clinic. And it was working in this underserved clinic that made me fall in love with this form of medicine, made me fall in love with the community, with the people I serve. The future of our healthcare is that we're going to need more providers, especially Spanish-speaking providers. If you're looking for a job that is extremely fulfilling, that gives you purpose, that gives you drive, that gives you energy, that gives you excellent pay, I highly advise physician assistant. Any career you go into, it's going to be hard. Medicine's no different. The only difference is that medicine is extremely rewarding. I love my job. And in the meantime, I paid off my student loans, which it's a dream come true.
The Health Professions Education Foundation is a nonprofit within the Office of Statewide Health Planning and Development. To make a donation or apply for a financial incentive award, please visit oshpd.ca.gov/HPEF.